All right, let's talk about this therapeutic class, anticoagulants. So what are anticoagulants? So their mechanism of action, so how they work is by exerting action in the clotting cascade. So it disrupts a step in the clotting cascade. And so the therapeutic effect is that it prevents clots from forming. So don't get me wrong, right? Anticoagulants do not break down existing clots. All right, and this works in the clotting cascade. So this does not have anything to do with the platelet. So just remember that, because then occasionally it may get confusing for some of you. Anyhow, so indications or reasons why we give anticoagulants include CAD, MI, heart failure, or basically conditions wherein a patient is at a higher likelihood of developing clots. So other indications include heart valve replacement, history of a thrombotic stroke, DVT or deep vein thrombosis prophylaxis or treatment. So prophylaxis meaning prevention, or treatment is when a patient already has the disease process. And then pulmonary embolism, or basically a clot in the lungs. So it can be used as prophylaxis or prevention, right? Or treatment if the patient already has it. So precaution, be very careful in patients who have blood dyscrasias or clotting disorders, patients who have had recent surgery, right? Because they may be at a higher risk for bleeding, and as well as concurrent use of other drugs that can affect clotting. So that's why it's very important to get the patient's history, get the list of their medications. So let's say the patient takes a lot of ibuprofen. We know that ibuprofen can increase their risk for bleeding, and so if they're already taking that and then we start them on anticoagulants, right, they may be at a even higher risk for bleeding. So again, make sure we're checking for that. Now, contraindications or reasons why we shouldn't give anticoagulants include pregnancy, depending on the agent, because there are anticoagulants who are okay to receive during pregnancy, and then as well as active bleeding. So meaning there's an active or ongoing bleeding, and it's regardless if it's visible or occult. So visible meaning you can visualize the blood coming out, right? That you know for sure that the patient is bleeding, but sometimes it's occult or hidden, such as when it's internal and you can't really see it per se. So side effects of anticoagulants include bleeding, nausea, vomiting, hypotension or low blood pressure, cardiac dysrhythmias, and it can also lead to thrombocytopenia, more specifically a heparin-induced thrombocytopenia or HIT. So this is basically a specific thing that can happen to patients who are put on heparin. And you'll notice it by a significant decline of the patient's platelet level. So thrombocytopenia means low platelet levels. So nursing actions are things that we need to do for our patients when they're taking anticoagulants. So we need to make sure we continuously assess them for active bleeding, both visible and occult. Make sure that they're receiving the right dose, and again, assess, right? Assess for the effects and side effects of the medication. We need to look at our labs. So follow our CBC, our hemoglobin and hematocrit, as well as our platelet levels, right? For signs and symptoms of bleeding, as well as if their platelet is really low, then they may be at risk for bleeding. Patient education, again, the treatment, why we're giving it, possible side effects, how to dose, what are the labs that they need to have, any safety concerns, making sure that they don't fall, when to call, when do they need to maybe notify their provider, maybe they start bleeding more, right? Anyhow, examples of drugs in the class. So we have Coumadin or warfarin. So warfarin is the generic name and Coumadin is the brand name. So the pharmacological class for that is coumarin derivative. So this is taken orally. So make sure that we need to take in consideration their diet, especially if their diet has a ton of vitamin K, because that will decrease the effect of this medication. And this is considered a pregnancy category X. So this is really not safe for pregnant women to take. And also take note that the dosages of this medication will be adjusted based on their INR level. So this is a blood laboratory result that we monitor when we're giving this medication, as well as PT or prothrombin time. So the goal INR level is determined by the indication or the reasons why we're giving it, the patient's response, and sometimes the prescriber. So that can vary, but usually we have to kind of follow that. and then adjust the medication based on it. So the reversal agent, so maybe if a patient develops bleeding, or maybe in cases of overdose, we give vitamin K. So vitamin K is the reversal agent for warfarin. And how I remember it, Coumadin, right, the brand name starts with a C, but it sounds like K. So I usually write it with the letter K to remind me that the reversal agent for Coumadin or warfarin is vitamin K. Now, another example of drugs in this class is heparin. So the pharmacological class of heparin is anticoagulant. So this can be given in an IV form or subcutaneously, right, as via an injection. And the IV dosages are based on the PTT. So the way I remember it is if you write the T together side by side, if you add a line here on top, it looks like an H. So again, H for heparin. So if you're asked what labs do we look at in adjusting heparin, then we know that it's PTT. Anyhow, so subcutaneously, usually the dose is set. We don't really use the PTT to adjust it, only if we're adjusting the IV dosages. Now, the goal PTT level can be, again, determined by the indication, the protocol, and the patient's response. And the reversal agent for this medication, so if we happen to give too much of this, or maybe the patient starts developing bleeding or overdose, then we give protamine sulfate. So protamine sulfate is the reversal agent for heparin. Next medication is Lovenox or enoxaparin. So enoxaparin or Lovenox is considered a low molecular weight heparin, so that's its pharmacological class, and the dosing is usually weight-based, but it can have a standard dosing based on the purpose or indication. Now, the reversal agent of enoxaparin or Lovenox is also protamine sulfate, because if you look at this, right, this Lovenox or enoxaparin is actually a low molecular weight heparin, so they're very similar to heparin, and so they have the same reversal agents. Now, another anticoagulants are your Eliquis or apixaban, or Xarelto or rivaroxaban. So these are factor 10A inhibitors. So XA, right? It's in their name, XA. So we're here, and then XA. So this tells you that these are factor XA or 10A inhibitor. Now we also have the Pradaxa or the bigatran ethoxylate, which are direct thrombin inhibitors. So as you can see, they affect the different parts of the clotting cascade.